you've just blessed us by participating in this again for the third year. So, Mr. Kennedy, welcome again to Health Freedom Summit. We're so honored to have you, and we want to talk about your new book, but I'm sure most of our audience, 99% of our audience knows who you are, but just for those who might not, you are an attorney and humanitarian, one of the leading attorneys and humanitarians in our country. You're the founder and president of Children's Health Defense, a nonprofit whose mission is to end childhood health epidemics and stop exposure to toxins. You're also a journalist, so powerful of a writer that they have tried to cancel you, but still you came out with a new podcast in February of 2021 called The Defender, which I love the title. I think that defines you very well. And your family is iconic, and you are another model of courage. And we can never thank you enough for taking such a leadership role in fighting corruption and pharma corruption and taking on people like Fauci and people like Bill Gates. So welcome. One of my favorite things about my job is I get to interview my heroes. And one of the things I admire about you most is that you respect other people, especially, as moms, we get dismissed a lot. We get called paranoid. And so it really means a lot when people like you lend your credibility and authority so that we can help raise healthier kids. And your book is action-packed and so well-researched. And I don't know where the best place to start is, but I was thinking maybe we could talk just as an example of the kind of corruption that is going on, the FOIA lawsuit that you did with Del Bigtree and ICANN. I'm really interested in that because it's just such a perfect example of how our national health agencies have been corrupted.
Well, that lawsuit, which is not really part of the book at all, but what that lawsuit emerged from, for many, many years, we've been saying, both myself and Del Bigtree, none of the vaccines that are currently, the 72 doses of the 16 vaccines that are now mandated for American children, in many states, they're recommended by CDC and become mandates according to state laws, that none of those vaccines has ever been safety tested against a placebo in pre-licensing clinical studies. And so, in other words, there's no safety studies and no functional safety study. And for many years, Anthony Fauci and many, many other people within CDC have said that's not true. Del and Bobby are making this up. We actually had I think in March of 2016, Del and I met with Fauci and with Francis Collins and with some of the other leadership of the agencies, and we repeated it and said, you keep telling people that we're lying. Can you show us a safety study for any of these 72 vaccines? And Fauci at that point made a play of looking through a file that they had brought with them and said, well, we didn't bring any of the studies here, but we're happy to provide them to you. And that was the last we ever heard from him. So we then sued him and said, we sued HHS and said, you're saying that these vaccines have actually been safety studied. Show us the study. And after about a year and a half of litigation on the courthouse steps, HHS came out and said, yeah, we actually have never done a safety study of any of the vaccines that are currently on the schedule. So there's been no effort to do the essential study that you would want to do for any medical product, which is to look at a vaccinated population and compare health outcomes to a similarly situated unvaccinated population for each of those vaccines, to make sure that the vaccine, because the vaccine has all kinds of effects that have long diagnostic horizons, that have long incubation periods, that are unexpected neurodevelopmental disorders, autoimmune diseases, seizures, allergic diseases that you can't really predict. and also early death. It's real, or laws of IQ. And we really need to know for every medical product, are the people who take that intervention after 4 or 5 years, are they healthier than people who aren't?
Right.
Because if a vaccine prevents you from getting measles, but it causes you to die of seizures, then it's not a good intervention. And what happened in 2017, the most popular vaccine in the world is the diphtheria, tetanus, and pertussis vaccine. It's called the DTP vaccine. It's given by Bill Gates and WHO to 161 million African children every year. And for many, many years, Bill Gates has been telling the world that that vaccine has saved millions of lives, 20 million, 30 million. He uses different numbers. And he asked the Danish government to support the program, to help him pay for these vaccines that were going to all of these African and South Asian children in India. And the Danish government said, yeah, we want to do that, but let's first make sure that the vaccine is actually saving lives. And they conducted a study that they did in partnership with Novo Nordisk and with the Staten Serum Institute, which are vaccine companies. So this was not an anti-vax study by any means. They brought in world-renowned scientists, including Peter Abe, who's kind of a deity on the African vaccine program, very pro-vaccine. And they looked at the data from African children over 3 decades. And what they found surprised them. And here's what they found, that though the DTP vaccine was preventing children from contracting the diphtheria, tetanus, and pertussis, however, the girls who got that vaccine were 10 times more likely to die over the next 6 months than children who didn't get it. And the girls were not dying of anything that anybody had ever associated with vaccination. They were dying of bilharzia, of pulmonary problems, of respiratory problems. Most of them were dying of pneumonia. They were dying of sepsis, of minor infections, etc. And nobody had ever looked and said, hey, it's only the vaccinated girls who are dying. And what it turns out is that the vaccine was protecting these girls against diphtheria, tetanus, and pertussis, but it had ruined their immune systems, so that they became very, very susceptible to minor infections, which for them, which a normal unvaccinated child would have been able to defend themselves against. But because of the damage to their immune systems, vaccinated children were getting very, very sick and dying.
Yeah, that seems to be the big concept that a lot of people aren't understanding, is the chronic illness, the toxicity, the depletion of the body in general isn't where you talk about the cost benefit ratio and the risk analysis, and it's hard to get that into people's heads. When you came down to my state, to Louisiana, and you testified to with Attorney General Landry, you were using Pfizer's own data to make some of your points. And one of the quotes and numbers you used was, you said that Pfizer's own data showed that people are 48% more likely to die of all causes from the COVID vaccine than they are to die from COVID itself. So how are these companies getting away with that, and why aren't more people reporting on it?
That is not exactly what the data showed. What the data showed is that when you looked at all-cause mortality, when Pfizer took 6 months of data, so they had 22,000 people who got the vaccine and 22,000 who got a placebo, and when they compared the deaths from all-cause mortality, first of all, what the data show is that during that 6-month period, in the vaccine group, 1 person died of COVID. of the 22,000 people. In the placebo group, 2 people died from COVID. And that allowed Pfizer to claim that the vaccine was 100% effective because the number 2 is 100% greater than the number 1. Most people, when they hear that the vaccine is 100% effective, they're thinking in terms of absolute risk rather than what that metric, which is called relative risk. And absolute risk would mean if you got the vaccine, you're 100% guaranteed not to die from COVID. That's what people think. And that's not what the data showed. What the data showed is that Pfizer needs to give 22,000 vaccines to prevent 1 death from COVID. Now, if you're going to give 22,000 vaccines to prevent 1 death from COVID, you better make sure that nobody is going to die from any of those vaccines. And what their data showed is that the people who were getting the vaccines were 5 times more likely to die from a heart attack. So in the placebo group, only 1 person died of a heart attack during that 6-month period, but in the vaccine group, 5 people died from a heart attack. What that indicates that for every life that they save from COVID, 4 people were dying from heart attacks, excess, unnecessary heart attacks. And that's what I was saying. I wasn't comparing the dangers of COVID to the dangers of the vaccine. I was just comparing, using Pfizer's data to compare health outcomes in the placebo group to health outcomes in the vaccine group.
In the vaccine group. One of the things that I think you do the best job of explaining to people, and it's because of your family's regular contact with people in these high up places of the NIH and NIAID, is talking about regulatory capture and how the pharmaceutical companies have completely commandeered these health agencies that are supposed to be there to protect us. And so a lot of people will quote the CDC or the FDA, but not realizing that they are so in bed with pharma. And it's always nice to hear you talk about that, if you don't mind.
Yeah, I mean, regulatory capture is not a new or a novel or even a controversial concept. It happens, and it's a function of, it's a feature of democracy, and it's a feature of the regulatory state. The regulatory agencies, through a series of mechanisms, through funding mechanisms, through personnel exchanges, and through power politics, after a certain period of time, become essentially sock puppets for the industry that they're supposed to regulate. And the health agencies, that dynamic is on steroids because of really unprecedented financial entanglements between the public health agencies and the pharmaceutical industry. So, for example, FDA receives about 45% of its annual budget from pharmaceutical companies. And that's not a healthy, dynamic for a regulatory agency. That would be, for example, I spent many years suing big polluters, but also probably about 20% of my cases were against EPA, because EPA is a captured agency, and it works very closely with the coal industry, the chemical industry, public utilities, and it becomes influenced by them. But what would EPA look like if 45% of its budget came from selling coal? And there were people in the agency who are actually incentivized to increase coal sales every year. Well, that's the problem with CDC and FDA. So the CDC has a $12 billion annual budget, and about $5 billion of that goes to purchasing and then distributing vaccines. So CDC is a vaccine company. You get promotions at CDC, you get bonuses, you get recognition from your bosses by increasing vaccine uptake. And that commercial aspect tends to subsume the regulatory function of the agency, so that the commercial, the mercantile tail begins to wag the regulatory dog. And the regulatory agency becomes a subsidiary of the commercial ambitions of the pharmaceutical industry. CDC also owns vaccine patents, so that when vaccines are sold, CDC and its parent agency, HHS, make money on that. NIH owns thousands of medical patents, including many, many vaccine relevant patents. So, for example, NIH claims to own 50% of the Moderna vaccine. So the more Moderna vaccines that are sold, the more money NIH will make. That's not a healthy situation. That's not a situation where we can have confidence that the regulators within that agency are serving public health, because their mission is so distorted by that, by the mercantile ambitions and impulses.
Right, absolutely. Not only are they getting such huge financial incentives to increase vaccine uptake, like you said, but anybody who criticizes them or makes them look bad, even on a mild scale, gets punished, like Andrew Wakefield, obviously, for example. But then you also speak about the Lazarus et al. Study, the Harvard study, and those guys were doing phenomenal work, and they were punished too. Can you talk about the Lazarus study?
Well, the Lazarus study was a 2010 study of the VAERS system, the Vaccine Adverse Event Reporting System. So the Vaccine Adverse Event Reporting System is, we've talked about now, there is no preclinical safety, functional preclinical safety studies done on vaccines. So, but what the CDC says is, yeah, we don't do any preclinical safety trials, which we do for every other medicine. We don't require them for vaccines. And by the way, the reason they don't do that is an artifact of CDC's legacy as the Public Health Service, which was a quasi-military agency. And the vaccine program was launched as a national security defense against biological attacks on our country. And so they wanted to make sure that if the Russians attacked us with anthrax or some other biological agent, we could quickly formulate a vaccine and then deploy it to 200 million Americans without any regulatory impediment. So they said, if we call it a medicine, if we call vaccines a medicine, we have to do these 5-year safety studies, and that's going to get in the way of our national security. And so let's call them something else. We'll call them biologics, and we will make it so that biologics are immune from the requirement that you do pre-licensing safety trials. So, and CDC, when it's criticized for that, says, well, don't worry. We've put in place a post-licensing surveillance system, so that if people start getting injured by these vaccines after they do get approved, we will quickly see it and we'll be able to respond appropriately. And that system is called the Vaccine Adverse Event Reporting System. The problem is it's a voluntary system, and there are many, many incentives for people not reporting vaccine injuries. So the doctors who see these vaccine injuries in their patients are asked to report them to the system, but put yourself in the shoes of that doctor. The doctor's being told by the CDC vaccine injuries don't exist, and there's no course in any medical school in the United States on vaccine injuries. So when you graduate from medical school, you tend to believe that people who report vaccine injuries are lying, or they're making it up, or they're suffering some kind of delusion. And then you tell a mother who's in your pediatric practice, I'm going to give these vaccines to your children and it's going to protect their health. And the child then 2 days later develops a seizure, or 2 months later, or 3 years later develops a food allergy to peanuts. Or when they're 4 years old, they're diagnosed with autism. And the mother comes back and says, I started seeing some of these problems right after the vaccine. Do you think it could have been the vaccine? What is the doctor going to say? Many doctors we can understand, and we know this, will say it wasn't the vaccine. This is just normal for that age group. Children, when they're 4, suddenly come down with autism, and or food allergies, whatever. So they don't report it. And as it turns out, everybody knows that the reporting that VAERS suffers from really dramatic underreporting. And this, again, is not controversial. David Kessler, the Surgeon General, many, many years, people from every direction have been saying VAERS doesn't work, it's broken. So in 2010, CDC commission, HHS commissioned a sub-agency called the Agency for Healthcare Research to develop a system that would not be voluntary reporting. It would be a cluster analysis reporting. It would be a machine counting AI system that would collect virtually all of the vaccine injuries. How does that work? Well, here's how. The HMOs have all of your records for your vaccines for tens of millions of Americans, all the vaccination records, plus all your health claims. If you have a vaccine, if you get certain vaccines, they can look at the vaccines that you look, and then they can look at claims for diabetes treatments, or for food allergies, or autism, or seizures, or whatever. And they can do a cluster analysis. They can correlate them, and they can say, hey, kids who get the hepatitis B vaccine during the first 30 days of life are 60% more likely to get a diabetes diagnosis 4 years later. And we can get really good data without relying on voluntary reporting. So CDC commissioned the Agency for Healthcare Research to design a machine counting program and to test it out on the Harvard Pilgrim HMO, and then to roll it out to all of the 10 biggest HMOs in the country, if it worked. 3 years later, the Agency for Healthcare Research and its lead scientist, Lazarus, and these were Harvard scientists, came back and said, hey, the system works like a charm. We are collecting huge numbers of vaccine injuries. In fact, 1 in every 37 people is reporting, and we're finding injuries in 1 out of every 37 vaccines given. So at that point, CDC was telling the public that serious injuries were 1 in a million. Right. Now you had a HHS agency that actually had real data saying it's not 1 in a million, it's 1 in every 37 kids is getting injured.
Wow.
So the Lazarus study said we are missing more than 99% of these injuries, not 99%.
More.
Or if you read the study, it says we found that fewer than 1% of vaccine injuries are actually reported. So when CDC got this paper, this peer-reviewed published paper from Lazarus and the Agency for Healthcare Research, they panicked and ran for the hills. And they shut off all communication. They shut down the pilot project. They put it on a shelf and they were never heard from again. And they made it so that the government officials who actually did that study and the scientists could no longer speak to the CDC officials who had commissioned the study. And if you read the Lazarus study, which anybody can look up, it actually says in the study, the CDC officials in charge of the study were no longer available for telephone communication or any other kind of communication. So that was their response. As soon as they recognized that these vaccine injuries were going to actually be reported, they shut down the system to keep the American people from knowing about it.
Let's wrap up. I know that everybody in this audience is going to go buy your book. I've got the audiobook version and I love it. It's such a gift to have your wisdom and all the research in one place. I know that we also need to help fund these lawsuits. You guys are doing, at Children's Health Defense, you're doing more to actually have an impact, because you have to sue them, you have to punish. There has to be a consequence when they hurt the American people like this. So we're going to put a donate button under this video so that people can donate to Children's Health Defense and help fund these lawsuits. But I just want to ask you for any more calls to action that we can do. Like, what is the one thing that we should be doing to help out?
You need to come to our big event against Mark Zuckerberg and Facebook. We're doing a massive demonstration in California. And by the time this airs, we will have announced the date.
Thank you. God bless you. Yes, taking the free speech issue is huge. Mr. Kennedy, thank you so much. God bless you. Thank you for your time. We're going to make the most of this video, and it'll multiply. I hope you have a great rest of your day.
Thank you.